Okay, drying him off. He's crying a whole lot. Very loud, very healthy. Okay, let's get him off of there. That's dirty. Here's a new one. Okay. We have all of our supplies today to do our assessment. Pen light, stethoscope, tape measure. We have a scale right here. Okay. He doesn't seem to be in pain, just traumatized from being born. I see some cyanosis on the hands and feet, but that's normal. I'm not seeing any jaundice. His skin blanches like normal when I touch it. His skin feels normal. He's green, but that's normal for his race. His movement is very strong. Seems good. Okay, we're going to just do some quick measurements now. All right. Let's move him over to the scale. Seems a decent weight, about 7 pounds. Let's go with that. Okay, we're going to do some lengths now. We have our tape measure. Going to check it in inches and centimeters because parents want inches, scientists want centimeters. Has a length of 15 inches. Wow, that's a long baby. And about 39 centimeters. Okay, let's measure his head. It's about 28 inches and wow, 77 centimeters. No, 71 centimeters, I'm sorry. Across his chest, he seems to be very oval shaped. I'm not thinking if there's going to be much difference. 31 inches and 78 centimeters. Okay. And over his belly. Okay. Let's see here. 32 inches, which is 81 centimeters. Okay, good. The cord. Oh, we need to take his pulse on his umbilical cord. Okay, it's about 120. That's pretty good. There's Wharton's jelly in the cord. Okay, just going to take a quick. Sorry. Okay. Okay, I'm not hearing any murmurs. Well, there's a slight, tiny one, but that should clear up in a few hours, and if it doesn't, we'll get someone to check up on that. Okay, some bowel sounds. I'm hearing some bowel sounds. Breath sounds. Okay. Okay, let's just check out breath sounds over here. Okay. His lungs sound a little wet, but he was just underwater, so that's normal. That should clear up. And he's not breathing labored or using any of his accessory muscles. He's crying, screaming, but he's not really grunting or whistling. Anything that suggests there's something wrong. Ooh. Temperature. Nurse, please hold this baby while I go get the thermometer. Thank you. Oh, good, thermometer. Okay, temperature. Oh, thank you, nurse, for holding the baby. Okay, temperature looks good. Okay, he doesn't seem to be in any pain. I see a little lanugo on his shoulders, and he's covered in a pretty good layer of vernix. He has a little stork bite in between his eyes. You know, when he starts screaming loud, it turns pink, which that's not really anything to worry about. I'm not noticing any contusions or anything on his head. His fontanelles, there doesn't look like anything's bulging. His birth was a pretty untraumatic one, so there's no evidence of trauma or anything. Face, 2 eyes, nose, mouth, cheeks, head. I don't see any cleft palates or anything like that. It all looks pretty symmetrical. His ears are a little high up on his head, if I'm being honest. I mean, that's pretty high. But they are both symmetrical. They both have ear canals. Every time his mom starts asking about him, he sort of looks over towards her just a little bit. Let's check his reflexes. Okay. Oh, he turned. Oh, yeah. Okay, both arms and legs go out. So he doesn't have a broken collarbone or anything, as far as I can tell, because his arms are both working. Okay. Okay, he blinks and his pupils react equilaterally, bilaterally. He does not seem to like having a light shine in his eyes. Okay. Oh yes, he has rooting reflex, and his hard palate and soft palate and his tongue all seem to be intact and normal. Okay. Palmar reflex is good. He spreads his little fingers and toes. Babinski is good. I mean, when I touch his palms, he grabs my hand. That's what I meant. Okay. Gonna put him on his belly for a second, but he's fine. Okay. Oh, good. That reflex is good. He turned towards it. His butt is symmetrical. His hips, okay. They both rotate normally. I don't think anything's dislocated or out of place. Spine is straight and C-shaped. Okay. His neck, there are no folds. It moves just fine. We already checked his clavicles and they're not broken. Inguinal pulses. Genitals look normal. This is a girl. And there hasn't been any urine or any DMs yet, but he hasn't eaten yet, so we'll get to that. And let's give him back to mom. Oh, he needs his blanket. Okay, I have all my supplies, gloves, a vital signs machine. Yep. I have a stethoscope, a pen light, and a reflex hammer. So how are you feeling today?
Good.
Okay, are you in any pain right now?
No.
Oh, so you had a baby. How's that going?
Good, it's exciting. He's crying all night.
Okay. I'm now taking her blood pressure, her heart rate, her respiratory rate, and her temperature. They're all normal. Okay, so stethoscope. Oh, you gonna like lay on the couch?
Yeah.
You're gonna do bowel sound, fart sound. Okay. Okay, I'm not hearing any murmurs, so it's sounding good. Good heart sounds. Okay, lung sounds. You can sit up now. Wait, I don't know. Oh, I had you lying down because I need to do your bowel sounds. Okay. I was like, why am I lying down for that? Okay, normal active bowel sounds in all 4 quadrants. Sounding good. Okay, now breath sounds. Okay, do like all 6 of them. Deep breath. Okay, yeah, just kind of tilt. Okay. Okay, I'm not hearing any abnormal breath sounds. Here, turn back, and then tell me if this hurts on either side. Okay, no CVA tenderness, so no kidney inflammation. Okay, this patient doesn't exhibit linea nigra, chlasma, or stretch marks. Have you been sweating a lot?
Yes.
Okay, well, sweating a lot is normal after having a baby because of your excess fluid volume. You gotta get rid of all that. How is breastfeeding going?
Good.
Good. That's great. Oh yeah, can you lay down? I'm just gonna push on your stomach. Okay. Okay. There's no clots that I'm seeing. She's not letting her own blood. Lochia looks normal. Episiotomy looks good, doesn't look infected or anything, and I'm not seeing any hemorrhoids. Oh yeah, here I'm gonna check your legs. Over. Yeah, you stop that. Yeah.
Like that.
Okay, it's just checking for DVT. Okay, do you feel any tenderness in your calves? Okay. And I don't notice any erythema or heat. Okay. How have you been peeing? You been peeing okay?
Yes.
Okay, that's
A lot.
Okay, just gonna check your reflexes.
Okay.
Okay. is a good. Okay. So we're gonna bring your baby in. If you're cool, if you want that. Do you want us to bring your baby in? Okay. She's interested in her baby. That's good. Okay. Stop.